All right, now last week on Health Digest, we featured NHIF and the value of having this insurance provider. And as in all our items, we asked you to engage with us through our various platforms. Well, our medical correspondent, Dr. Korir, compiled some of your questions and now joins me in studio to answer those pertinent questions and give further perspective. Dr. Masi.
Well, Michelle, as you've said rightly, we engage the audience on Health Digest and pick out some of the questions that you ask. And last week on Health Digest, we asked you if you have ever held or attended a fundraiser aimed at paying medical bills. And 70% of you said that, yes, we have held a fundraiser or attended a fundraiser to pay for medical bills. And Dr. Kenneth Wamea went ahead and said that every other day they are he's uploaded onto one or more groups, and especially WhatsApp groups, in order to organize for a medical fundraiser and the bills. And you will be surprised that out-of-pocket expenditure in Kenya has actually been on the rise, and it's from 2013, and this is according to the Kenya Households Health Expenditure and Utilization Survey, which is in our next board. And in this survey, 61.5 billion per year is spent on out-of-pocket expenditure. This is the money that you raise for several people who are asking to be helped to pay their medical bills. And out of this, 48.4 billion is outpatient services. Now, in Kenya, 17.1%, which is 1 in 5 Kenyans, actually has health insurance, and out of this, NHIF is the biggest provider. Now, most of you seek public facilities for healthcare, and that's 58.4%. 17% of you attend private facilities, and surprisingly, 13.1% go to chemists or pharmacies. And this is the practice in Kenya where people want to avoid the prospect of queuing in hospital or seeking the consultation from a doctor. And then 11.5% attend other facilities like mission hospitals. Now, moving on to the bulletin, Stanley Wamai at Wamai72 asked, what is the point? And now today I'd like to answer that. The point of having healthcare insurance is to avoid what you call catastrophic health spending. This is when faced with an emergency or a need for medical care, and you have to go out of your pocket, go into your savings in order to pay for those bills. And what happens is that thousands of Kenyans are driven into poverty because of this. Now, the point of insurance is to cover you. It's the same way that people take car insurance, so that in case anything happens to their car, the insurance gets to pay for this. And this is the same thinking that goes into healthcare insurance, so that in case of an emergency, in case you need to attend or to be attended in a facility, then you do not have to go through into your savings or sell your property in order to pay medical bills. Now, we asked you if you know or if you're aware of NHIF benefits, and most of you thought that NHIF only caters for bed charges only. And today I'd like to tell you that no, NHIF actually caters for almost everything, from the consultation with a doctor or the clinical officer or the nurse, any investigations that are needed, that is, if you need to go for laboratory tests or radiology tests, drugs that are administered or any drugs that are dispensed, dental services, nursing and midwifery services, surgical services. And this is one of the areas where most of you do not know that NHIF pays up to 500,000, which is 500,000 Kenya shillings, for a major surgical procedure. Radiotherapy, NHIF pays physiotherapy services, hospitalization, which is the inpatient care. If there is need for any admission in hospital, NHIF caters for that if you're a member of NHIF. Now, NHIF has moved into paying for cardiac or heart conditions, and they pay for open heart surgeries up to 800,000 or almost $1 million, depending on what the heart condition is. And so that is part of what NHIF covers. Secondly, and I think most of you know this, is that dialysis is catered for by NHIF, and they pay for 2 sessions per week. And the recommended sessions that anyone who needs dialysis needs to go for is at least 2 sessions per week. Now, This is the latest introduction by NHIF, which is the emergency ambulance services in partnership with the Red Cross. In case you have an emergency and you need an ambulance, now you call the Red Cross numbers and you give them your NHIF number and your ID number and your location and your kind of emergency, and they'll be able to respond. So in effect, actually, people have been calling for an improvement of NHIF, and we can see that NHIF is actually getting better and better. Now, after airing last Saturday's episode of Health Digest, we went ahead and we want to give you a sneak preview or part of the interview that we did with the CEO, Mr. Geoffrey Mwangi of NHIF. Have a look. Today we are talking about NHIF cover. Who is eligible to be under the NHIF scheme?
Any Kenyan resident, 18 years of age and above, is eligible to be a member of NHIF. All employed Kenyans are statutory mandated to be members of NHIF, whereby the employer is the agent. They do deductions and remit their monthly deductions to NHIF. We have what we call the informal sector, self-employed. They join NHIF on a voluntary basis. Why do members have to choose a facility in which to seek services from? When you choose your provider, I tie the population that have chosen that provider, and I give the provider agreed resource plan, that this is the resource plan to take care of outpatient services for this population whenever they want it, anytime they need it. Now, there are two things to that. The provider cannot provide services which you don't need. And the provider will be checked by you at the quality of services which they are giving, because if they don't give you good services, you will not select them to be your provider of choice. And the moment they have fewer people in their pool, the rest resources we give them. Why is it that NHIF requires the facilities to be accredited in order to provide services to those that have chosen to be under such certain facilities? We need to know what services are you able to give, so that we know what contractual obligations do we sign together and how do we reimburse you for the services you give. Kindly elaborate on the emergency ambulance services that you have announced will be provided to all Kenyans under the NHIF cover. When calamity hits, it doesn't select, it doesn't know whether you have the emergency package or you don't. So this is something we've added to synergize with whatever else we are doing with the specialized scheme. It becomes easier for us to give it to everyone. Are there plans to have NHIF as a universal cover for all Kenyans across the country, regardless of whether they are formally employed or informally employed? The kind of premium we are levying, 500 bob per informal sector per month, that is 6,000 per family per annum. It can only give you certain benefits. But if we pooled resources together, there is no stopping.
All right, and here with us in studio again, Dr. Mercy Korir. So quite a bit of feedback coming in from the NHIF feature that you did last week, and of course a lot more with that one-on-one with the NHIF CEO. But yes, what more really, in terms of information, do Kenyans need to know?
I think, okay, from this feature that we did, we realized that Kenyans really have a lot of questions to raise about NHIF, just on where they should seek services, whom they should seek services, and in case of complaints or queries, where it is that they need to get that information from. So this, we took it back to NHIF, you know, to take now, the onus is on them to provide their members with information, and available information. It's there on the internet, and they have offices all across the country where they can get this information. And so we hope that from this, that NHIF will actually pick a cue and get to be better in terms of customer care and customer service, and also in being open and transparent and providing all the information that members need to know.
And of course, just like what you were mentioning before, many of us initially thought NHIF covers, you know, the bed charges, or, you know, if you have to be there overnight, but it's an array of services. Like you mentioned, it can cover up to 500,000 shillings in surgery, but is this available to all NHIF holders? Because at the end of the day, there's different contributions being made by different calibers of people.
It is available for all NHIF holders. And remember that NHIF has categorized their hospitals into 3 different segments from category A, B, and C. So depending on which hospital you go to, the services are sort of limited. Obviously, in the high-end private facilities, there'll be limited services. But in the public facilities, all these services that we've listed are actually provided, and all NHIF members are actually eligible to receive these services. Yes.
And of course, there are those who need information on how to get registered with NHIF. How do they begin that process?
Well, this information is one on the NHIF website. On Huduma, at Huduma centers, actually, people can go and get registered to NHIF. Any NHIF office actually can register everyone. So we are seeing an improvement in terms of accessing services and being able to get these services. People do not have to come to Nairobi or the big cities in order to get these services. So they can get into any of these centers to inquire and to get registered. Also, in the public health facilities, they always have an NHIF office where people can actually go and get information. And the call here is that people should actually enroll into NHIF or any other health insurer. As we said, as you see, we spent billions in a year on just out-of-pocket expenditure to cover for health. Imagine what would happen if instead of always raising money for somebody else to seek health care, you use that money to develop yourself in another sector because your health is actually insured or it's covered.
Right. And speaking of out-of-pocket expenditure, it's another misconception when it comes to NHIF. If I walk into a hospital, a medical facility with my NHIF card, am I required to give any money whatsoever, be it for consultation fee, be it for medication? It's another misconception.
Remember that the services we've listed were from consultation, and that means from the moment you enter a hospital, you're covered by that. So it's from consultation and all array of services that you may need. Now, the tricky bit or the issue that people raised was that, and I think it's all across our public health facilities, that yes, you have an NHIF card, you've gone to this public facility where they require to do an X-ray, then they tell you the X-ray is down. Then you have to go out to another facility or to another establishment to have your X-ray done. So at the end of the day, then it really does not provide the service that is supposed to be provided. So on a bigger look at it, or a holistic look at it, NHIF cannot work alone. The government also needs, and this is both national and county governments, because health is a devolved function, also need to look into how to make services available and make those services quality. Because if you have a card and the hospital does not have the service that you require, then it's of no use. So actually these institutions or departments in government need to actually work together so that, the services can actually be seamless and can be provided all across board. And so that you avoid a situation where you go to a facility, they don't have medication, they have to send you out.
And you have to pay for that medication.
You have to pay out of pocket. Then at the end of the day, that's what people are asking. What is the point of having this cover then? Yes.
All right. Very eye-opening there, and I hope more feedback will be coming in even as we continue to give more information on NHIF. But this is it's Saturday today, and every Saturday on Prime Time you bring us Health Digest. What are you working on today?